Welcome to the Learning Lab. My name is Roman Garcia. Today we're going to continue with the theme that we ended with in our last video, which was a description or a describing the biometric protocol that we use in our facility, which was motivated by my frustration or my sympathies for patients who were coming from other facilities with very little information as to what was happening in their facility. So what we did is, little by little, as we gained experience, we developed this biometric protocol. But what I want to do now is I want to get this biometric protocol and I'm going to break it down. And I'm going to describe a facet of it so you can understand how this biometric protocol arose, how the idea came to us. So anybody that sees this video, they can start understanding that when they go or expect that when they go to a medical facility because they have knee pain, they should get a lot more explanation than just simply you have arthritis or that you are bone on bone. That is not enough of an examination or of information given to a patient so they can understand what's going on and what they need to do for themselves to help their condition. So what I want to do first is I want to show you a case study of ours, or a case that we had recently, and I'm going to describe one of the facets of our biometric protocol so you understand why it is that it is important that when you go to your medical or healthcare practitioner that they are using protocols similar to what you have seen in the past and what I will explain a little bit more in depth today. So this is a case that we saw not too long ago. This is the x-rays, this is the right knee, and this is the left knee. But today, anybody who has seen our videos in the past have seen these markings that we overlay on the x-rays. But I'm just going to go into one of the facets that make up the entire protocol. And before I do that, I just want to explain that as the human body evolved over millions of years, evolution, nature tends to use certain principles across all species. And we are no different. So any animal or any species that walks on two legs have very similar weight-bearing dynamics. Humans are unique because we walk completely bipedal and we have very flat feet. So nature has created certain weight-bearing geometric principles in our weight-bearing joints that can be illustrated or described if you know what to look for, if you see patterns in the joint structures. And these patterns is what makes up our biometric protocol. So before I describe what it is, one of the more stable geometric structures that humans have created or developed in building structures is the simple pyramid. Now, I'm gonna use the back of this right here, and I'm just gonna use what a pyramid is. It's no accident that the pyramids of Egypt have lasted 2,000 years. It's a very stable geometric structure. And 2,000 years ago, the architectures of 2,000 years ago, they understood how stable the pyramid structure is. Obviously, it has a very wide base of support and a very narrow apex, or the upper end of the structure. This makes for a very solid structure. Now, anything that humans have created, nature has created way before the human mind created such a geometric figure. This geometric figure exists in different forms in nature across all living entities. Now, if we go over here and we observe the joint, the human joint, and you're a little bit creative, you can see a pyramid structure on each side of the weight-bearing surface. This is the right knee. This is the right knee right here. This is the right knee. This is a close-up of this knee right here. Now, after observing many x-rays in my career, I started seeing pyramid structures inside the joint surface, the bone structure itself. It doesn't take much creativity to see a pyramid structure in the joint, in the bone structure itself. Or imagine a line straight down like this, a line like this, and then a line connecting. You basically have here a pyramid structure. But it's no accident that the human knee joint bone, the tibia, which is this bone right here that makes up your knee joint, fits a pyramid structure within its bone matrix. It's just that it's a flipped pyramid, but it's still a pyramid structure. And it makes sense that evolution and species such as ourselves that are bipedal, the joint weight-bearing structures assume a pyramid structure. Now, the reason that in the human joint, the pyramid is rotated up 180 degrees is that the weight-bearing load on humans who are bipedal with flat feet, the weight-bearing loads do not come straight down like this. That's not how they fall on the human joint. Because of the unique circular or spherical contour of the bone of the human knee joint, the weight-bearing loads as they fall on the human joint come in a diagonal pattern like this. So that's why in humans the geometric structure, the human geometric weight-bearing surface is of a pyramid, but at 180 degree with a 180 degree twist, which allows the weight-bearing load to come in a diagonal pattern, requiring the pyramid to be in this position. So in essence, the human knee joint is a pyramid inverted to support the weight-bearing load that come diagonally. So it makes sense that a pyramid geometric form fits inside the actual bone structure itself. Now, what I want to do is I want to go through the entire biometric protocol with these joints here. Objectivity is key. So what I'm going to do is real quickly, I'm just going to go and describe how it's done. You go with a straight line. Straight down like this. Straight down like this. Now, this vertical line right here starts at the medial tibial eminence. You got two little spikes right here. I described this before. This line starts on the tibial eminence, on that protuberance that's on the inside of the knee. On some knees it's easier to see in others. These are a little bit occluded by the arthritic change. The femur end overlaps. So you cannot really appreciate it too well, but you can still see it and use it as the starting point. Now, after you do this, you start to describe the pyramid structure. So you start off at the tip of the tibia, and you come across. These are not ideal. I can do this one better here. That's much better. This one's okay. You start at the tip over here, at the mid joint. You come across. Same thing over here. You come across. So you start at the tip over here, you start at the tip over here, and then you just connect the horizontal line to the vertical line. After you do that, you create the pyramid. And this is your weight-bearing structure right here. The larger the triangle, the more this particular knee is using that side as the primary weight-bearing structure or side. Now, why is this important? The reason it's important is because these biometrics right here give the examiner an idea of how asymmetrical or symmetrical their patient's knees are distributing the weight-bearing load. Now, this is basically how this knee is tolerating the weight-bearing load. These are the actual characteristics or profile of the weight-bearing load of this knee. You can see right here, these are not perfect, but they're as good as you can do with hands. You can see that on this knee right here, this outer triangle is larger than the inner triangle. What this tells the examiner is that this particular individual is shifting their weight more towards the outside part of the knee. In this particular case, this particular person is putting more weight on the inside part of this knee right here. These pyramids right here, these weight-bearing pyramids right here, tell the examiner how much this individual is relying on one side of the knee versus the other. So if they are not of equal dimensions on both knees, this individual is functioning in an asymmetrical manner. As the therapy continues, or as the intervention gets implemented onto these joints, and the person starts to feel better, you'll start seeing changes in the dimensions of these pyramids right here. Now remember, the weight-bearing load on human knees come in this direction. They are diagonal. They come in a diagonal pattern, just like this, in a diagonal pattern. Again, in a diagonal pattern. If this knee would be in a bow-legged or in a knock-knee pattern, these weight-bearing triangles will reflect that type of alignment. With individuals who are knock-knee or in valgus or knock-knee, you will tend to see this triangle larger than the triangle on the inside. And if it would be in a varus or in a bow-legging position or alignment, you will see the inner triangle larger than the outer triangle. There are exceptions to this, but basically what this gives the treating center is a representation, an objective representation of the weight-bearing loads that their patient is being exposed to. And by having an understanding of which side is being stressed more, you can implement strategies in order to change the size of these triangles. Because what this gives you is a guide on which side to focus on. But if you have no idea, if the interventionalist or this medical center or the person working with the patient, if they do not know the weight-bearing dynamics, how the weight is falling on the knees, they will be completely oblivious to which side they have to concentrate. It may be on the inner side, it may be on the outer side, or it may be on both sides, but it's usually only on one side. So unless you have an objectification of the weight-bearing dynamics, the examiner will be completely blind to what needs to be done in order to have or create changes at the structural level, which will create changes at the weight-bearing level, and that's reflected by the size of these triangles right here. So these biometrics are very important because they're basically ways of objectifying the knee condition itself. And normally, these objectifications are symmetrical to how the patient feels or how they're reacting or responding to the treatment themselves. So what I want to do now is, I'm going to use now my assistant Anna here and demonstrate or show what it would look like on a real case here, on how this triangle would be reflective depending on the situation that you're dealing with. Now, from past videos, we know that Anna is not knee. She's not knee. We've done these biometrics on her before. So in her case, she's experiencing, her weight-bearing dynamics would look like this. Her lateral triangle, lateral weight-bearing triangle is larger than the, she's knocking on both, would be larger than her inside or medial triangle. Because since Anna is knocking, she has a very large weight-bearing surface on the outside and a very small one on the right one. That does not mean that Anna will go on to develop if she goes on to develop arthritis, she will not. But if she would, the probabilities would be that she would develop arthritic changes on the outside part, because she weight bears primarily on the outside part, which objectively, when we've done our biometrics on Anna, the lateral triangle, the triangle on the outside, is larger than the medial. But that's not to say that Anna may not develop arthritis if she goes on to develop arthritis on the inner half, because by her inside triangle being smaller, if she participates in activities that require weight-bearing loads over the inside part of her knee more than the outside, because of the characteristics of the activity that she's doing. For example, if she decides to start running or play badminton or tennis, the dynamics of the activity, if it requires weight-bearing load across the inside part of the knee, since her medial triangle is smaller, it would take less stress or weight-bearing compressive loads over the inside part of her knee for her to develop arthritic changes on the inside, because she has less surface areas to tolerate increases in weight-bearing loads. She has more, the outside part of her knee, because its larger weight-bearing surfaces, is more tolerable to compressive loads than it is on her medial side, on the inside part. And again, these triangles will give the health practitioner, the doctor, the chiropractor, whatever professional, will give an objectification of these weight-bearing dynamics. And thus, by having that objectification, you can transfer information to the patient that the patient can utilize in order to create an environment across the knee that will help in prolonging the health of the knee itself. So Carlos, we'll go back here. So in essence, that is the observations that I've made throughout my career with patients who I've seen that come from other medical centers. It could be an orthopedic, could be a general practitioner. It really doesn't matter the discipline. What I find and what I get frustrated at is patients come with very little information as to what exactly is happening in their knees. Most of the times they don't even know whether they're bowing, knocking, or what's going on in their knees, because the truth is that the examiner doesn't know themselves. So they really cannot transfer information to their patients. So that's why this biometric protocol and these weight-bearing triangles is so important, because these are basically baseline that the medical center can follow in order to objectify the subjective improvements or not of their patient, and create interventions that will promote changes in these objective biometric readouts. So basically, that's what I wanted to cover today, is the importance, the biology of these triangles and why they are so important for anybody that goes to a medical center, if they ever have knee pains, that something similar to this type of protocol is being done as part of their physical examination or evaluation. If you're not getting these biometric readouts, you're not getting a proper knee examination. So anybody that sees this video experiencing knee pains, if you're frustrated with the physician and the kind of instructions or explanations that they are giving you, then please just give us a call. Contact information is always printed there on the videos. You can contact us at any time, and it's extremely easy to perform these biometric overlays over x-rays that you may possess. It's extremely easy. Just give us a call and we'll help you out. For anybody that sees this video, thank you. Until next time.